Disc bulge versus muscle pain. What's the difference? Back pain can be really confusing, right? You bend down, lift something heavy, and suddenly pain shoots through your back. Everyone around says it must be a disc bulge. But is it really? Or could it just be muscle pain? Let's break this down clearly so you will know the exact difference between disc bulge and muscle strain and when you actually need to worry. Understanding the basics. Think of your spine like a stack of bones separated by soft cushions. These cushions are called discs. They act as shock absorbers, helping you move, bend, and twist smoothly. Now, when one of these discs pushes out of place slightly, it's called a disc bulge. But when the muscles around your spine gets overstretched or torn, that's muscle strain. Both can cause back pain, but how they cause pain and where you feel it makes all the difference. How the pain feels? If it's muscle pain, it usually feels like a dull ache, stiffness, or soreness in one area, most often in the lower back. It tends to get worse when you move a certain way, but it improves with rest, heat, or gentle stretching. Disc pain, on the other hand, is usually sharper and can travel down your leg or even your arm. That's because a bulging disc can press on a nearby nerve root, causing radiating or nerve pain. If you ever feel tingling, numbness, or weakness, especially on one side, that's likely a sign of a disc issue. Quick self-check. There's a simple way to get an idea. Try lifting your toes or standing on your heels. If you feel weakness or if the pain shoots down the leg, it might indicate nerve involvement, which points towards a disc problem. But your back just feels stiff or sore, especially after sitting too long or lifting something heavy. It's probably a muscle strain, which usually heals in a few weeks with proper rest and physiotherapy. Red flags, don't ignore these. If you have any of these symptoms, don't wait. See a doctor immediately. Pain with numbness or tingling sensation, loss of bladder or bowel control, sudden weakness in one or both the legs, pain accompanied by fever or a recent injury. These could be signs of something more serious. Diagnosis and treatment. Now, should you get an MRI? Not always. Here's something interesting. Even people with no pain can show disc bulges on an MRI. So, it's not the first step. We usually recommend an MRI only when the symptoms don't improve or when nerve signs appear. For most people, back pain, whether from a mild disc issue or a muscle strain, gets better with proper posture, stretching, and rest. Recovery and care. For muscle pain, use heat or ice packs, gentle yoga, and short walks. They help the muscles relax and heal faster. For disc problems, physical therapy, core strengthening, and avoiding long hours of sitting are the key. In severe cases, medicines or injections may help, but surgery is rare and only for extreme conditions. The good news, over 90% of people recover without surgery but with Ayurveda. The secret is patience, movement, and consistency. So remember this, muscle pain usually stays in one area and feels sore or stiff. Disc pain travels, tingles, and sometimes causes weakness also. If you notice numbness, shooting pain, or leg weakness, see your doctor early and get it checked. Back pain can be fixed, but only if you understand what's really causing it. If this video helped you, share it with someone who needs it. Subscribe to our channel for future videos because knowledge can literally save someone's spine.